That's normal. It's big. It's not very deep. Look here. Look at the rough edges. But here's smooth. This is normal. This is abnormal healing. It's still superficial, also it's not deep. But see, these are things to look for. These are things to look for. Sometimes we put tubing system in, they inject the medicine back here on their shoulder and it goes in the tubing, comes out on their corneal surface. If you're going to treat your horse 8 or 10 times a day, then tubing systems are useful. They're not necessary, but I had one owner of a horse that had a serious eye problem. She was treating her horse 400 times a week. I didn't have enough guts to. I'm the one that told her to do it. It gets better too, but I didn't have enough guts to compute it. Okay, painful eye. Where's the ulcer? Look, there's something here. So I stained it. Now you can see it. Every eye gets stained with fluorescein. Look yourself. Look yourself. I learned a lot from this horse. This is actually a very famous American thoroughbred racehorse. And I saw him and I learned something right here. He was an extremely dangerous horse to work on. Here, white is neutrophils and abscess, and blue is edema, and the blood vessels are going in. This turned out to be fungi. I used different stains, and some of them, this is fluorescein stain over here, and his rose bengal. He had a dry eye. The infection was affecting his tears. A few weeks down, 3 weeks later, cornea's growing, blood vessels are growing in, the cornea is clearing behind it. 5 weeks later, treatment's over. I think this looks terrible. But the horse is comfortable. But he was dangerous. But we stopped all the therapy because the cornea was in. Long story, but I went back. I drove by the stable where this guy lived every day. Finally, I just couldn't do it anymore. I had to stop. So 5 years later, I went and looked at him, and this is how he healed. He went from this to this without any therapy. He just learned. Horses have the ability to heal their corneas. How do we help them? And how do we not do stupid things that slow the healing down? That's what we're learning, and we're getting a lot better at it. And we're coming to Australia to talk about it here in a month. If your vet needs an update on how to treat horses with corneal problems, tell them about the seminar we're going to have. I do lots of cytology. I scrape the corneas and look at the cells under the microscope. It's an easy test. Doesn't looks terrible here, doesn't it? Using the handle end of a scalpel blade. Some people use cytology little brushes to get the cells. Here's doing one of them. The horse is standing up. This is how you get the cells. There's a term in horse ophthalmology called melting. Melting is what the horse does. What the horse does when the cornea is injured is it sends enzymes into the injured tissue and digests that injured tissue and gets rid of it. Tissue is no good, horse gets rid of it. But it doesn't control this process very well. And sometimes it gets rid of the normal tissue too. Now, I saw this horse and let's see, 2010. The whole cornea is affected. Not just 6 millimeters, all of it. And it's getting deeper. And I didn't know what to do. I didn't know what to do. This forced me to do research that eventually I figured it out. But I know what the problem is now, and most veterinarians do, melting means too many enzymes. So you use serum or plasma, use EDTA topically to slow the enzymes down. So I don't know if you noticed that horse that I saw 5 years later, the blood vessels have grown in. Finally, when the blood vessels finally met in the center, the therapy was over. Finally, I'm thinking, why do I have to wait about using blood Or why do I have to wait for the blood vessels?